first question that came in from this parent was, what are the concerns or decisions that therapists would want the parents to know about speech and occupational therapy before even engaging in one?
I think especially when you're talking about the autistic community, then one of my, not concerns, but one of the things that I really do want parents to know about is the length of the therapy.
Okay, so the second question that came to us was, when you're considering, right, or let's say if the parent is considering a new therapy or therapist, so it's sub A, sub B, sub C, and sub D, so it's choose sub A, what are the benefits, advantages, and disadvantages of this therapy, speech and occupational therapy?
Well, the advantages of speech and language therapy would be that we work very closely with your child and we will help them in the crossover. It's not just like in a clinical setting, then everything we do aims to be functional, and we hope that it would, all those skills that we teach your child would generalize out, so then it should have academic impact. There's a lot of research, as I'm sure you know, about the impact of speech and communication difficulties, the impact on emotional status in especially in young children, and it can lead to things like bullying and stuff in school. So the emotional welfare of children is heavily impacted. So by addressing those speech language communication needs, then actually we can help the child at school as well. And we don't even need to go into a school to do that. Just those skills can generalize by helping the child, and then it can benefit their emotional well-being as well.
Amazing, thank you. Would there be any disadvantages though to this therapy?
Honestly, here in Malaysia, I would say cost.
Cost.
Yeah.
Okay.
Yeah.
And why would you say that though? Is it like very expensive? Like what are we like ballpark figures, just for us to have an idea?
It's not. I mean, it depends on how much therapy your child needs. It depends on the duration of the therapy. It can be, and especially if you need more than one therapy, then it can mount up. The problem is. I don't want to, diss the government or anything like that, but the problem is I've had some clients who have gone through the government route, and unfortunately, you've got a severely autistic child who sees a speech and language therapist once a month, and it's just not enough, and that's because that's what they can afford. So therefore, if you have to go private, then the cost kind of does mount up. So that's one thing that unfortunately I would say that's like a disadvantage if you don't have the financial means, because it can be quite costly.
Understood. So just for our better understanding as well, like for centers like the ones you work with right now, like do you all do like is it like an hourly rate thing, or do you go like in packages? Just for us to understand.
We offer packages, so certainly the centre that I'm at, we offer packages of like 12 sessions, which gives you discount, which is great. But then we also do that also because that can be a lump sum, quite a large lump sum for parents to pay. So we also do like individual therapy sessions as well. So and we usually do about 1 hour sessions is the most common for us to do. So.
Okay. So just to give an idea as well to the public, like what would it cost for like an hour session? Like just a range, like from the different centers you work with, and also with the based on your colleagues in the industry. So like a range, if you could.
I guess from what I've heard from different centers, I guess probably from around about sort of 200, maybe 150, 200 ringgit to about 300 ringgit. So within that scope.
Okay. So I would say it's, again, when it sort of builds up, it might get a bit heavy. But, for those who can afford it, it is definitely something you can explore so that, your child would have a better shot, and and being as close to, if I may use the word normal, in society, and sort of integrate, and sort of be a contributing member, an active contributing member, because again, children with ASD are fantastic. A lot of times they're just misunderstood, and they have so many skills. They're so artistic, right, and musical.
They're often seen as naughty children, and so you might see a child having a meltdown in the middle of a shopping mall, And it's because, they have sensory difficulties. They're overwhelmed by the smells, by the sights, so all the people, by the lights, they're overwhelmed and they can't process it. And so they, lie on the floor. People walk past that, not knowing the situation, and it's often seen as, oh, such a naughty child. And then the parents are kind of shamed. So this happens a lot, unfortunately. So the parents are, well, your child is so naughty, why, and I mean that. It's not just an Asian thing, that happens everywhere, but it's just very unfortunate. I do just want to highlight that in a kind of concern for me in Malaysia is that our industry isn't well regulated at the moment. So you have to just be a bit careful of the therapist that you choose. And if they're trying to sell you additional therapies that you're not sure about, always get a second opinion.
Yeah, from a medical doctor.
From a doctor, from somebody reputable,
Okay.
Or a therapist that you do actually, that you already work with and trust. Because unfortunately I have had a few of those stories as well. And so trying to sell therapies that maybe your child doesn't need. So,
okay, which I think is a very common thing even in the medical industry, right? You check yourself in and you're like, oh, we should run this test for you, that test for you, and then
we'll offer you this, we'll do that, and then your bill gets like, and I think one of the things that I do pride myself, coming from the UK, coming from NHS background, is I would never refer to something if I didn't think the child absolutely needed it.
Yeah, and I think that's very important because that speaks about the integrity, I think, of the practitioner as well. You don't just recommend for the sake of recommending. You should really do your own reading.
And that's the one thing I would always say to parents is do your own research. If you're not comfortable, then go get a second opinion. If you're not 100% sure about me personally as a therapist, that is fine. Go see somebody else. And see how you feel, because the most important thing when, as a therapist, working with these children is that we have really good rapport, and not just with the child, with the whole family. Because I don't just work with the child, I work with the whole family.
It's a support system, right? It's not just an isolated case. Okay, lovely. Okay, next question, 2B.
Sorry.
Does the therapy align with the goals you are trying to accomplish for your child?
Always.
That's right.
Any good therapist, any decent therapist, any just any therapist should basically speak to the parents during initial consultation. Should speak to the parents and should have a discussion with the parents about what their goals are for their child. If the goals don't necessarily align, for example, we have situations where maybe the parents' goals are here, the child's level is here. So we're not saying we're not going to get there. All we're saying is we just have to take it a little bit slower. So let's lower the goalpost from here to here, and then continue and continue and continue. But we should always be working with the families. And one of the things that we always focus on is what the family's goals are for the child. If the child can't advocate for themselves, then it's the family who does. So it's very important that we know what you're looking for.
Correct. And I think from what you've just mentioned as well, it's also about the scaffolding. So rather than you set a very high benchmark which cannot be achieved, and then both the family and the child gets disappointed, because sometimes they'll be like, why can't you be better? Why can't you pick up faster? So again, unnecessary stress again on both sides. So
we don't want to set anybody up for failure. So let's do these little benchmarks so that the child can achieve. They're achieving, and they might be tiny achievements, but we'll celebrate them anyway because it's an achievement.
Correct. I think it was one thing I learned back in management school, which is this thing called celebrate all wins. So regardless of, again, whether it's a huge thing, like, if they could maybe learn, 5 new words today, and they came back and they spoke to their parents about it very excitedly, that already in itself has value. It's not like the child has to learn, the whole dictionary for you to say, oh, well done.
And that's a really good point, actually. It's, usually what I say to parents is let's just target 5 words. I don't know how you do that. But that's usually
magic number.
I know, right? But that's usually one of my first things would be, if particularly non-verbal children, if they do have that capacity to imitate, then I'll say, okay, let's choose 5 words that are really meaningful for you in your house. It could be eat, it could be sleep, it could be, car, whatever, and let's just 5 words. Let's really target those. And this again, we get the parents on board, so they target those at home as well. And so we kind of bombard with those words. And like once the child starts picking them up, they go, okay, we've got these. Okay, let's do 5 more. And so we put it into chunks. So
Lovely.
what's it they say about you can't eat a whole elephant, you have to put it into chunks, right?
Well, I won't want to eat an elephant because they're an endangered species, but yes, we get the idea. Like an oversized ostrich,
Sorry.
We can eat ostrich. Yeah, so there we go. Okay, so question 2C would be, will the therapist allow the parents to be present and participate if needed during these appointments?
Again, any decent therapist will say yes. If a therapist is not allowing parents into the session room, unless there's a good reason, such as the child's not really focused or the child's not, attending to the therapist at all, unless there is a reason like that, then every parent, I actually request parents to be in. Certainly initially, I request parents to be in the session with me so they can see what we're doing, they can follow up whatever we're doing in the centre, they can follow up at home. So I do request that initially. I do understand that parents, of course, in these trying times, parents are very busy, they have work, they have a lot of stress going on, so sometimes sometimes this is the only time when they drop off their child. It's the only time they have to maybe go grocery shopping or something like that. So I understand if they can't be at all the sessions, and so that's why I make it a choice. But I have what I call like open door policy. So any parent who wants to join any session at any time is welcome.
Lovely. Yeah, and I think that should be the way, because again, I think, because you did mention earlier in our early discussion that it's a family project. It's not just a project on the child. So if the parents can be involved, again, the empathy is built there, the awareness, the understanding is built there, and they could even give you valuable feedback like, oh, this happened to let's say child A today, and what does it mean? And then when you have those kind of meaningful engagements, then you have the buy-ins. Because again, it's not like you leave the child there, child gets fixed, you take back and happily ever after. It's not that. It is work in progress, and it is a support system. It's a community that we need here. And it starts with the family.
Yes.
Lovely. Question 2D. Is this therapy something that benefits the child long term, i.e. will it help the child when they become an adult?
Ideally, yes. So again, the goals that we choose for children would be initially, set up with the parents. That we will have that discussion with the parents. We'll always talk about kind of long-term goals. We'll talk about short-term goals. But everything, especially like in terms of like speech and language, obviously everything is very dependent on the individual child, but the goals would always be functional. And so functional goals are the key. Functional communication is the key, because that will set you up for life.
Lovely. So again, it is a long-term investment in your child, which pays off on both sides as well, right? Because like it or not, due to biology, parents, as much as they want to be around for their children, for their whole lives, it's just not biologically possible, and that's why, again, this is about hard facts of life, right? And we want to make sure that at least, when the parents are no longer around, the child has at least, the ability to be independent, to be able to be functional, within society, to at least, live their life the best that they can.
We want them to have the best quality of life possible.
Thank you. Lovely.